Hello friends, welcome to Expert Medical Coding. In today's video, we're going to learn about ICD-10 CM PCS updates 2023 fourth quarter part 5. In this video, we're going to cover two coding clinics. The first one is Parkinson's disease with off episodes, and the second one is myelin oligodendrocyte glycoprotein antibody disease. So let's get started with the first one. Parkinson's disease with off episodes. The update here is code G20, that is Parkinson's disease, has been expanded with the creation of 5 codes describing Parkinson's disease with and without dyskinesia and fluctuations. Parkinson's disease is a progressive neurodegenerative disease that presents with motor symptoms such as tremors of the hands, arms, legs, or head, as well as non-motor symptoms such as depression, anxiety, and pain. Currently, there is no cure for PD, and treatment consists of the medication levodopa to relieve the symptoms. Dyskinesia is the involuntary movement of the face, arms, legs, or trunk. Parkinson's disease fluctuations refer to periods of on episodes where there is a positive response to the levodopa, followed by periods of off episodes where levodopa wears off and Parkinson's disease symptoms reemerge. So the update here is the G20 code has been further expanded with 5 codes, and they are G20.A1, Parkinson's disease without dyskinesia without mention of fluctuations; G20.A2, Parkinson's disease without dyskinesia with fluctuations; G20.B1, Parkinson's disease with dyskinesia without mention of fluctuations; G20.B2, Parkinson's disease with dyskinesia with fluctuations; and G20.C, Parkinsonism unspecified. Let's go to the scenario. A 67-year-old male patient was referred to a movement disorders outpatient clinic due to a 1-year non-disabling intermittent resting tremor of the left hand that later progressed to also involve the contralateral hand. On neurological examination, the patient had normal cognition, Meyerson sign, glabular tap reflex was present, oculomotor examination was normal, and intermittent mild resting tremor was observed in the left hand, as well as mild signs of asymmetrical cogwheel rigidity and bradykinesia left greater than right. Gait and balance were normal as well as postural reflexes. The patient was diagnosed with idiopathic Parkinson's disease. So how is this presentation of Parkinson's disease be coded? And the answer is, we have to assign the code G20.B1, that is Parkinson's disease with dyskinesia without mention of fluctuations, as the patient was experiencing mild resting tremor. So we have to assign this code because the patient is experiencing mild resting tremor. So we have to code it as Parkinson's disease with dyskinesia. And there are no fluctuations here, so without mention of fluctuations to be taken. And the code here will be G20.B1, Parkinson's disease with dyskinesia without mention of fluctuations. Let's go to the index and search for the path. Go to the main term disease under the subterm Parkinson's, and here the patient doesn't have any fluctuations, so we have to take it as without mention of fluctuations, and the code here will be G20.B1. Now let's go to the next scenario. A 75-year-old patient with a 16-year history of Parkinson's disease was referred to a movement disorders outpatient clinic due to deterioration of Parkinsonism and frequent falls. Falls occurred more frequently in the early afternoon when the patient felt more unsteady. The occurrence of wearing off and unpredictable dose failure after lunch was documented, along with occasional mild dyskinesia. Final diagnosis listed late-stage Parkinson's disease, defined by the presence of motor complications that have significantly compromised the patient's health condition. So how is late-stage Parkinson's disease with motor complications and associated falls and wearing off be coded? So the answer here is, we have to assign the code G20.B2, Parkinson's disease with dyskinesia with fluctuations, as the provider documented mild dyskinesia and wearing off, which indicated the patient is experiencing off episodes. So as you can see here in this scenario, the patient has documented mild dyskinesia and also documented wearing off. So we have to code this as G20.B2, Parkinson's disease with dyskinesia and with fluctuations. And if you go to the path, in the index, search with the main term disease and subterm Parkinson's with dyskinesia and with fluctuations, it will lead you to a code of G20.B2. Let's go to the next scenario. Next scenario is a 68-year-old patient with a 20-year history of Parkinson's disease was referred to a movement disorders outpatient clinic due to falls and worsening of motor fluctuations, namely wearing off approximately 5 hours of daily on-off fluctuations. No cognitive or behavioral complaints were documented. Clinical observation documented severe off and on freezing as a major cause of falls. The patient did not present with postural instability as documented by a good performance in the pull test. So how is Parkinson's disease coded for this patient? So answer here is we have to assign code G20.A2, Parkinson's disease without dyskinesia with fluctuations. The patient experienced on and off fluctuations daily. Therefore, Parkinson's disease with fluctuation is assigned for this encounter. So no documentation of dyskinesia in this chart. So only we have fluctuations. So we have to assign code G20.A2, Parkinson's disease without dyskinesia and with fluctuations. And if you go to the path, search for the main term disease in the index and subterm Parkinson's, and here without dyskinesia but with fluctuation. So the code here will be G20.A2. Now let's move to the next coding clinic, and that is myelin oligodendrocyte glycoprotein antibody disease. So update here is the code G37.8 other specified demyelinating disease of central nervous system was expanded to create new codes to identify myelin oligodendrocyte glycoprotein antibody disease, and the code is G37.81, and other specified demyelinating disease of central nervous system, and the code is G37.89. Please like, share and subscribe to Expert Medical Coding. Thanks for watching.